I'm Tim Gustafson, and if you own an RV or have an adventurous lifestyle like me, you live life to the fullest. So when you finally get a chance to put your head down at night, you don't like to sleep, you love it. But in order to sleep at night, you have to have all your what ifs covered. I'm going to talk to you about a must-join association if you own an RV or have an adventurous lifestyle, and it covers everything you wanted your health insurance to cover and much, much more. So what is the must-join association that could save you tens of thousands of dollars? Well, in order to appreciate the solution, you must fully comprehend the problem. We've been in a health insurance crisis since 2010. Right now, there's only 6 types of health insurance. There's Medicare, there's VA, there's TRICARE, there's the Unaffordable Care Act, there's Medicaid, and then there's private insurance through work. Most of these are government programs that borrow money from each other, and collectively they're underfunded, so in order to help save costs, they're going to deny claims and reduce benefits. And I'm not telling you anything that is shocking here. You already know it. I'm just articulating it for you. So what does this mean for the hospitals? Over the last 2 decades, about 1/3 of the 1,100 trauma centers have closed. Right now, there's level 1 trauma centers, which are considered comprehensive, which if you're in an emergency situation, that's where you want to be. Level 2 are considered intermediate. They do have a 24-hour surgery staff. Level 3 are considered standard hospitals. And level 4 can handle scrapes, cuts, broken bones, and they're really there for life support prior to you being transferred to a level 1 or a level 2 trauma. So this has created a greater need for you to get to the right hospital. Ground ambulances bring you to the closest hospital that's available to you, and they respond to 37 million emergency calls every year. 90% of these are within 5 miles of your home because, well, 90% of your time is spent within 5 miles of your home. And over the last decade, almost 1/4 of the rural hospitals have closed. And of course, the older you get, the more likely that you're going to need an ambulance. Air ambulances have been able to provide level 1 and level 2 traumas to 82 million Americans that would not have access otherwise. They respond to over 500,000 calls per year, and 60% of these are actually transferred from one hospital to the next, so they're not picking you up on the side of the freeway. Here's the interesting fact though. Due to the Deregulation Act of 1978, this made the only governing body for air ambulances the FAA. So the Department of Insurance has as much influence over the pricing as they do over Southwest Airlines. So what is the solution? It's Masa. Masa stands for Medical Air Services Association. It was first started in 1974. It's been serving families like yours and mine for 45 years now. Today, Masa has over 1 million members and 22 offices worldwide. And they have an A+ superior rating with the Better Business Bureau. And their motto is, any ground, any air, anywhere. So Masa, most importantly, is an association, not an insurance, except in Florida. Florida considers it insurance. So when was the last time that you heard of an AARP member getting their 15% discount denied by Denny's? Or a AAA member that got their tire change denied? Never. Associations say what they do and they do what they say. One thing that many years in the insurance business has taught me is if there is a loophole, an insurance company will find it. In fact, they write them in their policy. If you ever review it, by every benefit, it'll say may cover. Do you know why it doesn't say will cover? You're absolutely right, because they may not want to pay your claim. So Masa guarantees that there's no health questions, there's no age limits, there's no claim forms, there's no deductibles, there's no network limitations, there's no dollar limits for emergencies, and there's worldwide coverage, and they even cover pre-existing conditions after 90 days. If we look at a couple examples of ground ambulance, on the left we have somebody that got a 20-mile transport. So this would be somebody from out of town to in town. It was roughly $1,700 after the insurance paid the usual and customary charges, left the injured person with a $1,300 bill. And then the next was a 9-mile trip. So this would be from in town to in town. 9 miles isn't all that far. And this left a $1,400 bill after, or I'm sorry, $1,000 after insurance paid their $400 of the $1,400. Here are the air ambulances. On the left is an example that was outright denied by insurance. This was an individual that had stroke-like symptoms, but the insurance company determined that there was no life-threatening injuries, and that's why they felt it was right for them to deny the claim. On the right, it was a young girl. It was actually a daughter of a nurse, and she was in a fire, and she got burned. So she had to be airlifted. This is one of the best payers in California, and this magically turned a $41,000 bill to $8,300, which is still pretty catastrophic for most individuals. So what are the chances you're going to need ambulance insurance? Well, the chances of you being in a car accident per year from January 1st to December 31st is 1 out of 250. The chances of your house burning down or having a catastrophic loss on homeowners insurance is 1 out of 1,400 in a lifetime, which if you add up your cost of homeowners insurance over a 30-year mortgage, it's close to $50,000. But the chances that you're going to need an ambulance in your lifetime is 1 out of 2, which was surprisingly low to me. I thought it would be closer to about 70%. But so not only does Masa cover what your health insurance should cover, but it covers transportation for any reason. So if you need specialized treatment that's not available locally, they'll fly you to where it's an appropriate medical facility. Again, they'll cover ground or air ambulances, 100% coverage for you. They'll do organ retrieval, or they'll bring you to the organ or the organ to you. They also do return services. So if you're hospitalized more than 100 miles away from home, and the treating physician approves it, Masa will actually cover the flight for you to be able to recuperate at a local hospital. And they'll do escort transportation, so they'll be able to fly your spouse, a family member, or a friend with you, space permitting. Visitor transportation, so if you're hospitalized away from home for more than 7 days, they'll fly a family member or a friend round trip to come visit you. If you're traveling with a minor, a grandchild, or a pet, they'll cover the transportation for them back to their residence with a qualified attendant. And they'll do vehicle returns. So any car, any van, any RVs, any dirt bikes, any trucks, whether you own it or rent it, they'll get it back to the rental place or they'll bring it back to your residence. They'll do mortal remains transportation if you're more than 100 miles away from home when the good Lord takes you home. And that's, again, it's worldwide coverage. The asterisk there is they do not cover the ambulance services on Antarctica. So membership options, there's the platinum option, which you can either pay monthly or annually. If you go directly through Masa, it's a $45 a month premium for a single individual. Through me, if you join an association, it's going to be $27. And a family, which would be a husband, a wife, and any and all kids up to age 26, it's $35 a month. For both of those, you just do times 12. That's your annual premium. There's no discount there. However, the next two options, you can prepay and get a little bit more for less. So you can get travel advisor. So if you're traveling to a foreign country, they'll let you know if there's any health or safety issues. They'll help you find an English-speaking physician. They'll provide a professional translator. You'll have access to a 24-hour nurses hotline. Then you also get a scannable MyID bracelet that, by a hospital tablet, can pull up any and all of your medical records. And for this, you can do a one payment for 5 years. You get basically 5 years for the price of 4.5. For an individual, it'd be $1,305. For your family, it'd be $1,755. Or if you're over age 50, you can actually become a charter lifetime member, which would be one payment. You own it. You'll always be a member, and there's no hidden fees like in a timeshare where you have all these hidden annual blah, blah, blah fees. And for an individual, it would be $2,900. For a family membership, it would be $3,900. So as I said, to get those discounted prices, you have to join an association. We have the American Senior Benefits Association that provides education, advocacy, and also some discounts, and it's a free membership. And in order to get that discounted pricing, if you click on the link below, it's one application. You'll be able to join both Masa and American Senior Benefits. Also below is a link for you to be able to watch the 2016 ABC investigation on the air ambulances price gouging. But I want to thank you very much for your time and attention, and please click on the links below.